People who have back problems, sometimes it's not the back, sometimes it's the feet. Hi, Dr. Layla here. I just wanted to talk about the arches in the feet and how most people don't realize that they have a problem in their foot until it's too late. And sometimes they have to deal with excruciating pain called plantar fasciitis. It's not a fun thing. It's inflammation of the plantar fascia in the bottom of the feet, and it usually happens because of lack of arches in the feet, tight calf muscles as well as hamstring muscles, which usually happen because they're lacking the arches in the feet. Now there's 3 arches in the feet. Most people think that there's one arch, so they lift their foot up and they're like, look, I have an arch. But when they put their weight on it, that's a whole different story, because weight bearing, that's when you realize whether or not you have ligament strength, and if there's ligament laxity, then your arches are going to collapse, and that can happen with an accident or a fall. It can also happen from pregnancy, weight changes, or numerous things can cause you to have a laxity in your ligaments and causing falling arches. Also, if you have a back issue, for example, your lower back has a nerve that travels between the lower spine that actually controls the arches in your feet so the strength in your feet are controlled by the nerves traveling from the lower back. So now there's 3 arches in the feet. There's a medial arch, there's a lateral arch, and then there's a transverse arch. These are the parts of the feet that should not be touching the ground. Only the heel, the ball, and slightly on the toes. This is somebody who's completely flat-footed. There's no arches and they roll in quite a bit. Somebody who rolls in, that's called pronation. And a lot of times you'll see people either pigeon toe or knock knees, creating that deformity because of these that they were either born with or they acquired over a period of time. Also, if they supinate, which means they turn outward, that also causes bowing of the knees. So you create a lot of deformity in the legs, and that's something that you can totally avoid by just getting your feet checked. Don't wait till you actually have problems in your feet, because a lot of times we go to the dentist to maintain the health of our teeth whether or not we have the pain or not. So the feet are important to get checked. The spine is really important to get checked, and the feet, you can easily get a examination of the feet. In my office, we do it over a 3-dimensional view box, which it takes 18 different measurements of your feet. So essentially it'll show if you're pronated, supinated, if you're putting more weight on one side versus the other, and it also shows whether or not you're lacking arches, one of the arches or all of the arches. So if that's the case, then all you have to do is get man-made arches, which will give you support where you need it. As you can see on this, there's the transverse arch, there is the medial arch, and here's the lateral arch. And if you excessively turn in, they put some substance here that basically pushes you out, keeping you neutral. And when you're neutral, your leg muscles are working better, which means that your outside leg muscles are recruited to give you that support that you need. So it stabilizes your back. That's why these are called pelvic stabilizers. So people who have back problems, sometimes it's not the back, sometimes it's the feet. So get your feet checked, get your spine checked, and make sure that you give the support where you need it. Thanks for joining me. We'll see you on the next one.